Revision is often confused with conversion. A revision is when one does an operation to modify an operation without changing the nature of the original operation. A good example is the revision of a Roux-en-Y gastric bypass to a distal gastric bypass to induce more malabsorption. A conversion is when one changes the nature of the original procedure. For instance, transforming a restrictive operation into a malabsorptive operation. And a prime example of this is the conversion of a gastric band or a sleeve gastrectomy to a mini gastric bypass or a duodenal switch. So there are many different reoperations possible. Some of them are revisions and some of them are conversions. In daily practice, most reoperations are in fact conversions. They're usually done to treat either a complication from the first original procedure or to induce weight loss in patients who have regained weight after they were initially successful with the first procedure. A revision can be necessary for different reasons. One reason is to treat a complication from the original operation. Good examples of this are, say, a slip gastric band or people who develop severe reflux as a result of a specific operation. Other examples are swallowing difficulties or malnutrition, or for instance, people who develop an ulcer in a gastric pouch after a gastric bypass, and that ulcer does not heal with medication. Another reason to do a revision is, of course, weight regain in patients who were initially successful after the original operation. Most surgeons would agree that a revision can be considered in those patients who have regained more than 50% of their excess weight, of the weight they had lost after the primary procedure. Reoperations usually take place several years after the original procedure. Occasionally, they take place fairly soon after an operation, especially when there's an acute complication. And examples of this are an acute slippage of a gastric band or inability to eat or drink when a stenosis and narrowing develops after a gastric bypass, where the small bowel has been joined to the stomach pouch. In my practice, 20% of all operations are revisions or conversions. They are always done laparoscopically and can sometimes be very difficult and tedious. It's very unusual that we have to change from a laparoscopic approach to an open operation. The amount of weight a person can lose after a revision operation to induce weight loss depends on several factors. And these factors are the following. Number one is the nature of the original procedure. Number two is the type of revision that is performed. Some operations work better than others. And then number three is, of course, the patient. What are the wishes of the patient? What kind of operation are they willing to accept? What type of operation are they happy to undergo? Can we operate on the bowel or not? Is the patient going to be compliant after an operation? Will they follow the dietary advice? Will they change their eating habits and lifestyle? So it's not really possible to predict exactly how much weight a patient will lose after a revision weight loss operation. It is well known that on average, the weight loss after revision is not quite as good as with a primary procedure. Most experts would agree that losing more than 50% of your weight or excess weight after revision is a success. Having said this, there are patients who manage to lose all their excess weight. And they are, of course, the most happy patients, but not everyone achieves this. It's important, I think, that surgeons who do weight loss surgery and revision surgery try to find the best possible operation for that individual patient without causing any harm. This means that most of the time, a few investigations will be necessary in order to give the best advice to that particular patient. The solution or the operation has to be tailored to the needs and the physiology of the patient. And sometimes it is actually best not to do an operation at all.